My name is Professor Nick Maynard. I'm a consultant surgeon at the Oxford University Hospitals Foundation Trust in Oxford. So I trained as a general surgeon, and that really means all forms of abdominal surgery and neck surgery as well. But I always was attracted to upper gastrointestinal surgery. I think it's really challenging surgery, and I've always liked to do challenging, difficult surgery. It's an area where you can really help patients and make a huge difference to their lives. And I've always enjoyed that aspect of surgery. But I think probably one of the major reasons was my real mentor when I was training at Guy's Hospital in London. And back in the 90s, Guy's Hospital was probably one of the greatest centres in Europe for training in esophagogastric or upper gastrointestinal surgery. And my great mentor there trained me for several years, and he was an inspirational figure. And really, having worked with him, there was no turning back. I fell in love with this specialty. The surgery is really challenging. It allows you to operate in all different parts of the body, in the neck, the chest, and the abdomen, which is one of the very few specialties where you can do that. So it's very challenging, satisfactory surgery. But it's a patient group, most importantly, where one really can make a huge difference to their lives. And I find that incredibly rewarding. Golly, that's a difficult question. I think I'm really good at talking to patients. I think I have a great rapport with patients. I'm a very empathetic person, and patients who I treat in this specialty often are very unwell, particularly those with cancers, and these are very challenging diseases to treat. So I think you do need to have a doctor with huge empathy, and with whom you get on. And I always say to my patients that having a positive mindset is really important to helping you cope with your illness and get through all your treatment. And part of that is actually having a really good relationship with your doctor. So I really pride myself on my relationships with patients and the empathetic way I deal with them. Golly, that's a difficult one. Yeah, I guess always the patient's always right. That's not always true, but actually it often is true. And patients know their bodies, patients know there's something wrong. And it's terribly important to listen to patients. I guess the other real mantra for the way I work is teamwork. And I think in a challenging specialty like upper gastrointestinal surgery, having a great team is terribly, terribly important. And I think I pride myself. I set up the upper GI team in Oxford in 1997, and I've built up a big team, and I'm really proud of what we've developed. And I think we are very well known for the great team working philosophy that we follow.